is there any news?
Sierra has stabilized, is doing good. The infant is low birth weight at 4 pounds.
Okay, nice.
We'll have more information.
Thank you. She called me a couple hours ago, said that she'd gone into labor and she needed my help. So I called an ambulance.
Labor?
Here we are.
We didn't even know she
Labor?
was pregnant.
Yeah.
This is amazing.
Doctors just told us it's a low birth weight baby. She's only 4 pounds, so.
Wow. She
what
was so
happens.
obese that we didn't know.
Low birth weight is defined as weight less than 2,500 grams or about 5.5 pounds. Babies that are born under this weight need immediate care they need immediate medical attention. Some babies can be two primary causes for low birth weight: preterm birth, which is prior to 37 weeks, and intrauterine growth restriction, also known as IUGR. And there are no risk factors for intrauterine growth restriction. Here we're looking at smoking rates by age. You can see the under 20s and the 20 to 24 are pretty high.
So I'm not really sure where she was staying, but my best bet would be probably in a condemned building, something that's been abandoned. It probably doesn't have any electricity or any heat, no running water. So there's definitely some serious factors there, and I told her all of this, but
they could be living in a pollution zone, in a high factory zone, where there's a lot of environmental pollution going on that could affect them. Psychological stressors, again, if they're living in poverty, those two go together there. And unwanted pregnancies or negative attitudes, the mother may choose to delay getting help. She may not show up until late in the third trimester.
doctor?
Yes, I've checked on the infant, and the lungs are not fully developed. Currently, we have her on a ventilator. Implications could include some brain trauma. We'll find out more.
Physical disabilities, the system, the body is just not fully formed yet. Kelsey's going to be in the neonatal ICU for up to a month. Worldwide, 16 to 27% of all babies are low birth weight. United States, 6.4, and in Washington State, 4.8. African American population, 8%. Native American, Alaska Native, 6.4. Asian Pacific Islander, 5.8. Hispanic, 4.8, and white non-Hispanic, 4.3. An opportunity for the different agencies to network better, to be able to combine the resources that they have, and can then therefore reach bigger populations.
Risk factors for pregnant women by providing support and resources to women and children into care.
Following through the process, getting them started, and checking up with them regularly to find out how it's working for them to keep them on programs.
So as you can see, this is a pretty big issue. It affects a lot more people than some might think. And
if you're in a position of assisting with a non-hospital birth or an emergency birth of somebody, what would be your way to be able to tell how quickly you need to be able to get help? Visually, if a baby's this big, you have a clear sign. But if they're that size, what's your gauge? What are you looking for? How are you going to be able to tell? This is really a global issue where the access to care is much different. Many women, more women than not, don't get the opportunity to have babies at low birth weight, meaning below 5.5 pounds. They really are going to need help breathing and some additional medical attention. So babies born that small, you must get extra medical attention. There's no way you're going to be able to. We'd rather see these other countries improve their services and access and reduce their number of infant mortality rates and infant death and low birth weight, and trying to balance this out a little bit better. I think that's what